Hi and Dumelang. Welcome to yet another interesting podcast of Mahlogonolo Thobile Foundation's Untold Premature Birth Stories. Today in our podcast, we've got a very special guest. We decided to open it up to our different doctors. So she's the first one to grace her presence at this podcast. We've got Dr. K today, who's here to spend some time with us. For those that don't know who Dr. K is, I'm going to ask her to introduce yourself. Welcome. Please introduce yourself.
Hi everyone. My name is Khutso, Dr. Khutso Sebetseba. So I am a pediatrician, which, like you said, is a doctor for small people. Small humans are my favorite thing in the whole entire world. I'm also a mom to 4 boisterous boys. So I think, they were also premature. So it's one of the things we'll be talking about today. But I'm very excited to be here and I'm loving the podcast. So well done on that.
Thank you. Thank you so much, doctor. And you said that you're a pediatrician. I remember the first time I heard about you. It was just a few months after getting a yes to work with Dr. SK. One of the things that we do as the foundation, we go into the hospital to introduce our organization to new mothers that have just given birth, to let them know that there's a safe space in our organization where you've got a tribe of mothers that can hold your hand through prematurity. We know it's a lonely journey. Yeah. And I remember the NICU manager was saying to me, Mosh, there's a doctor here, she's a pediatrician, and she's also a preemie mom. Oh, okay, that's interesting. Then came World Prematurity Day. We got lots of invite. We ended up arriving in Soweto very late. And the following year, when we started hosting the first session at Dr. SK Matzek Memorial Hospital in Diepkloof, you were the guest speaker on that day. You still remember?
I remember it not being a planned thing. I was just there to see what was going on, and then I just felt so compelled to just talk, because I think there were so many mothers that were still in that prematurity journey. Yes. A lot of them still had their babies in the ICU. They were still feeling all these feelings of anxiety and fear. Yes. And I remember just being so compelled to just share and just let them know that there's hope on the other side. They make it through and they grow up and they become these naughty human beings.
Yes.
But I know what it feels like to be in there, and I think I shared that letter that I wrote to the NICU mum.
Yes.
And that's the first time we met.
Yes, and I was so excited. I'm like, finally I get to meet her. And she also shared her story with us. Wow. And what is your day like as a doctor? I mean, you decided that you want to work with these little human beings. I mean, you're a woman, you could have chosen to be a gynecologist, help us during the pregnancy. Before you even tell us what your day is like, what inspired you to focus specifically on these tiny human beings?
So, we go through medical school and you're kind of exposed to everything. You're exposed to, like you say, gynae, you're exposed to surgery, internal medicine, all of this from the beginning of medical school, kind of right up until the end.
Yes.
And I remember kind of in medical school, my first day, it must have been in 4th year, in the pediatrics ward, and I said, that's it, that's what I'm going to do. And then I kind of went through medical school, went through internship and community service and all of that, and every single year, my passion for children just became more and more and more ignited, and I almost forgot about everything else. I purely had tunnel vision, Like I always say to a lot of people that the last time I saw an adult as a patient was probably in my internship year, because then the rest of my community service was just in pediatrics, because I knew that the goal was to just work with tiny humans. And the reason for that is that kids are amazing. People are always so surprised by, just my own kids. People will say to me, wow, you actually like your kids. I'm like, yeah.
You love them.
We love our kids and we like them, but I know that it's complex.
Yes.
And I think that the thing about kids is they are better when they say they're better. They truly teach us God's love for us. They truly teach us the power of prayer. They teach us to believe in hope and have believe in miracles, and I think day to day working with kids is just miraculous, honestly. And you see them come out of things that an adult would have never come out of this, you know. So I think kids are just magical, and every day you work with kids. Like I always tell people, I play with children for a living. I literally get to work, I play, and then I go home. That's my job. So I mean, it's pretty easy to see why that's what I chose, right? So yeah, so that's why I chose pediatric.
And as a pediatrician, like you're saying that your job is just to play with kids every day, because when they leave home they are sick and the mummies don't know what to do with them, and when they get to your consultation room you're all smiles, you know, you're ready to play with them, you're ready to hear from them, and they leave there a different person altogether.
And you know, a lot of people will say to me, is it not sad being a pediatrician because you see them sick? I'm like, yeah, but they get better, and they really get better, and there's no external factors to why they can't get better right now. Like they don't feel like going back to work, or the boss said something to upset them, or you know, they need more sick leave because they have some admin to do. When kids are better, they are better. When they are sick, they are sick. And that's the thing. It's the transparency and the honesty that just makes them so magical.
And genuine love.
Absolutely.
Genuine love.
Yeah.
You're guaranteed to get the genuine love and those tiny hugs from them. Oh my word. Oh, I love it.
Yeah, no,
kids are just amazing.
Absolutely.
And you fell in love with working with children before you even became a mom.
Absolutely. I mean, I always say that I think I knew that I wanted to work with kids, right? But my true passion for peds and my true understanding in terms of empathy really, really came in when I became a mom to premature boys. You know, I think that we can learn all these things in the book, you know, but there's so much they teach us in school. There's so many cases and exams and all these things that you go through, but you really become who you are when you are truly put to the test and allowed to experience it, you know. And I always say to everyone, don't despise humble beginnings, don't despise difficulty, because they really do shape us and mold us into the people that we are meant to become.
Yes.
And for me, it's absolutely that, because I think that I was a certain type of doctor before I had the boys, and then I'm a completely different person after I had the boys. So I'm sort of very grateful for that, because it absolutely shaped the pediatrician I became.
Okay. And you mentioned that you are a preemie mom. Can you briefly take us through your prematurity story? It's interesting to hear that she's a preemie mom.
Okay, so yeah, I'm a proud preemie mom. In 2015, in 2014, August-ish, I fell pregnant. First pregnancy.
Excited.
Completely naturally, yeah. Excited. I remember peeing on the stick in the morning, learning that I was pregnant, and I had decided I was going to be those fit yoga moms.
Oh,
know?
yes.
So I remember going to like Discam or one of the pharmacies or one of these magazine shops.
Yes.
And buying all these magazines about how to be healthy, exercises to do in pregnancy.
Oh my word.
Buying the vitamins. I was born.
Yes, you were there.
I was there, you know. I remember then, you know, going home, whatever. And about 2 or 3 days after finding out I was pregnant, I just felt so sick. I just felt like, no, man. I mean, I know there's morning sickness, but no, this cannot be it.
It can't be.
Fast forward, a friend of mine does a sono for me. She was actually specializing to be a gynae, and it's like a little bit of a mess because she's not sure what she's seeing, whatever it is. But, you know, ultimately, one of the doctors, and this was while I was still working in government in the state. So I'm lying on the bed. One of the doctors comes in, puts a probe on, and he says, okay, so I'm seeing many little sacs. And I was like, okay.
Many?
Whatever, yeah. So that was very confusing. But it also, like, first they didn't know what they were seeing, and then they were seeing many little sacs. I was like, I just need to go somewhere else.
I just need to get a second opinion.
Like a second and a third and a fourth opinion. Anyway, that happens, whatever, and I have to go back to work and act like nothing happened because, wow, what a morning, right? About a week later, I get an appointment with a gynae who then, you know, became my gynae. I get an appointment with her and I tell her, listen, I went, I spoke to my friend did a sonar, they're not sure what they saw, but it was many little something and they're not sure.
Many little something.
Okay. And then I remember going on the bed. And by then it was obviously a week or two after my first test, so they had grown a little bit.
Yes.
And then she was already seeing 4 little flickering heartbeats. But I remember when she started counting, she said, okay, so there's definitely more than one baby. So with family histories on both sides, I thought, okay, maybe twins, okay, a bit overwhelming, but let's just see how this is gonna go. Then I remember she started counting, and she said 1, and then she said 2.
Yes.
And then she just kept counting, and then she said 4, and I was like, no,
it can't be
4. And then she's like, definitely 4, and then she kept counting, she counted again, and then I just thought, oh. And I remember their dad being so quiet,
sitting there listening to the conversation.
Like he was just, but I think both of us. I mean, I remember driving out. So anyway, we finished the gynae gynae consult. At the beginning of the consult, she'd said to me, you know, how would you like to deliver? And I said, normal delivery.
Natural, yes.
You know, she said, how are you going to feed them? And I said, exclusive breastfeeding.
With
and,
confidence.
You know, with confidence, you know, and she was like, okay, and she went through all the questions, and I think I gave like the textbook answer.
Yes.
All the questions, this is what I'm going to do. This, because I'm also a yoga ball mom, I've bought the ball, I've bought the weights, I'm that.
Yes, and you're there.
I'm there, like I'm ready. So I give her all these like textbook answers. And then she's like, we go back to the table, and then she scratches everything out. She's like, this is not going to be possible. This is probably not going to be possible. She basically takes out another page, and she goes, okay, so we need to rethink this plan, because everything you think, this little picture you have of
that you have
is probably not going to plan out this way. Anyway, we have this discussion, and I remember driving home with hubby and him saying to me, saying nothing. Was he surprised that there's more than... we were both just very
surprised.
shocked.
Yeah. There's too many little things in there.
No, does that even happen?
Is it possible?
Right?
Did the doctors actually see?
In fact, when we were on our way out, she even, I think, second guessed herself, because then she was like, let's just check one more time. So then I had to get undressed again, went back, and then she did the
yes.
again, and you know. Anyway, going through that pregnancy was rough medically, because you can imagine your tummy is also growing at 4 times the rate. It's 4 times the amount of hormones. It's 4 times the everything. So it was very, very stressful, but it's also 4 times the complications, and 4
times everything,
and 4 times the risk. So I remember Googling once about, you know, survival in premature quadruplets, or survival in quadruplet pregnancies, and the stats were not good at all. So at that point, I told myself, I'm not going to Google again.
Yeah, no, you.
At
that point, I would also stop reading anything.
Yeah, no, and I mean, I'm a pediatrician, so I mean, I should have enough to keep me going, but I actually did not. You know, my role in that as a mom, as an expectant mom, was so much bigger than what you imagine, what your knowledge, what university teaches you, and that kind of thing. And I remember I had a journal, because remember I told you I was like,
yes.
So I had that whole pregnancy journal. I wrote in it once, because I remember thinking, if we are to walk this journey, and at the end of this journey have lost a baby, have lost all my babies, I don't want to have all this stuff that reminds me. Yeah. So I remember just like, I wrote once in that book, and never again. I never wrote in that book, because I just thought, because you know there's those apps, right? That are like, this week your baby is the size of a peach. And you're like, okay, 4 peaches. And then you keep going forward, and you're like, okay, watermelon.
The size.
How are 4 watermelons going to fit in my belly, you know?
Yeah.
Yeah.
How is that going to be possible?
So so there's your faith, and there's prayer, and there's blind like trust, but there's also like knowledge and like common sense, you know, because you're just like, there's no way, guys. Where? You know.
Did you even think of going to a different doctor just to be certain?
So the thing about it's kind of like a relationship with your pediatrician, right?
Oh yes.
It's very trusting, very sacred, and no one can really, it's not based on knowledge, it's just almost based on, I want to say a vibe, but I definitely think it's something deeper than that. Okay. And I think the sensitivity and the honesty with which she handled every step of the pregnancy
Yes.
For me, I thought, you know what, even if we don't come out of this with 4 healthy babies, I'm so grateful for her vulnerability and her presence and her availability.
Yes.
You know, I think every step of the way I thought, no matter what, there's no one else I would rather go through this journey with. You know, and I really do believe that God brings
certain people in your life for a reason, for a purpose.
And it's not necessarily going to be a book reason. It's not necessarily going to be the best whatever and the whatever, you know.
Yes.
But it's going to be who God has qualified to be in your space at that point, you know. And I definitely think that she was qualified by God to walk this journey with us. So there was no, I mean, there were lots of people, you know, there were lots of like,
and as a doctor, you know a lot of yes, and sometimes you'll be told, oh, the best hospital it's Netcare in this area, the best pediatrician is this one in Cape Town, and as a doctor you'd want the best for your kids. It's your first pregnancy, and now with yours it's going to be a special one.
Yeah, absolutely. You know, and then you like read the stats, like what are the statistics? How, like in the world, how many quadruplets are there?
Yes.
And how many of them are naturally conceived quadruplets without fertility treatment and all that? And then you realize, and then you kind of have to bring yourself towards yourself. And you're like, you know, God put them there. But if He doesn't sustain them, there's a reason for that.
There's a reason for that.
You know, it's easy to say it now. It's easy to be like, you know, I told myself if they don't survive. But at that moment, you are begging and praying. From the moment you know they are 4, you don't know how you're going to pay the school fees, but you're like, God, please. Like from the moment you know that they are 4, you want 4 babies at the end of it. You know what I mean?
Yeah.
So it was tough. It was a hard pregnancy. I remember doing my maternity shoot. You know, the cute one with the belly and the heart. I did mine at 18 weeks.
At 18 weeks?
At 18 weeks. Basically
it's because we had 4, so it grew.
Exactly. So I basically looked like I'm going to pop tomorrow.
Tomorrow at 18 weeks.
At 18 weeks. So it was
in
all
this
like
body. And where was the yoga mat and all those?
The yoga mat. It never got unrolled. Sorry, guys. Because like I say, growing at 4 times the rate, making 4 humans at the same time was not child's play. But it also came with the complications we know. You know, it came with the hypertension. It came with
I was about to ask about that.
All of them. I basically lived in the hospital. I remember being booked off work from 12 weeks. 12 weeks, I was booked off work. They said it's no longer safe for you to be at work. 12 weeks. I remember being admitted.
And you had to be at bed rest.
Yeah. I remember being admitted at 21 weeks. 21 weeks. And I stayed in hospital until the day they were born at 28 weeks.
You stayed there?
On an IV drip. I stayed in the hospital. In a wheelchair. Like, I wasn't allowed to walk. I wasn't allowed... Literally, I could walk to the bathroom and I could bath or shower.
Just short distance.
Short distances, because
within your room.
The fear was just the weight they were putting on my uterus would send me into preterm labor, and that's why I actually got admitted, is that my uterus was starting to get irritable. But thank God we managed to keep them to 28 weeks to the day, and on the day they turned 28 weeks, then I ruptured membranes, and then we had no choice because my water broke. Basically.
Yes.
We had no choice but to deliver them, and it was honestly the most terrifying day of my life. Terrifying. Like, I am to date not sure that there's anything that can scare me as much as knowing that your 4 28-weeker babies are going to be born today. You know, I got the injection, the steroid injection to mature their lungs, and around 7 o'clock we went into theatre.
PM.
7 p.m. It was a busy theatre. There were lots of people.
Yes.
4 pediatricians.
Yes,
4
because
midwives.
they're going to welcome too many little people.
It was a very busy
and
night.
they needed to be there. Hands on the deck.
They needed to be there. You know, then.
And even extras.
Yes. Oh no, there were lots of extras. There were just people everywhere. I remember just people everywhere. And baby number 1 comes out. Baby number 2 comes out. And they all come out crying, that mousy,
yes,
you're not sure, cry, but there's a cry. They all come out screaming, weeing, doing all the things that children do when they're born, but they are very, very, very small. I remember seeing them and just thinking, you are perfect, but you are so tiny. Like, nothing can prepare you for that, you know. And 28 weeks is small. It's very small. It's not terribly terrifying, but it's small. And for them, because they had to occupy the space that's usually occupied by one baby, they were even smaller because they were sharing all this.
Oh yes,
do you know what I mean?
yes.
Yeah. So they were very small. They were tiny.
Tiny
not
humans.
Attractive, no. Not attractive, but the love kept us there. But thereafter, I experienced massive blood loss, massive blood
You had to
loss.
get blood transfusion.
Yeah, but I was extremely unwell. I had to go to the ICU, and it was, so I myself was not well after having them.
Yeah.
And it was a little while before I could see them, because I was so
Yes,
unwell.
you had to rest as well,
And
recover.
And I was, I think I stayed in hospital for a couple of weeks after they were born. Not just for funsies, but because
because you
I
also
was unwell,
need. Yeah, no.
And
you
no
are
one talks
a super
about.
mom.
you
are. I
do
remember with me as well. I woke up in ICU with one child. I was there for 5 days, and I started physio the second day when I woke up. So I can imagine with you, with all the weight that you carried.
No, it was madness.
And worse, you gave birth at 28 weeks. Mine, it was later, at 34.
But still, I think we get what we get.
Yes.
And my story is not to minimize anybody else's story. And
no,
I think,
no.
Like I always say that, a cesarean section is a very, very, very hectic thing to go through. And we don't give ourselves credit for that. We don't give women credit for the fact that you've gone through a major operation and now you have to just be like, hey, and like breastfeeding and bonding and whatever and physio and you know what I mean? And it's a lot. And I think it's such an important part of this process is accepting the fact that you have gone through major surgery to bring a whole fully human being into the world, and now I have to take care of them, So I think I always say that we need to be kind to ourselves and forgive ourselves, especially preemie moms, because there's a ton of guilt. There's a lot of guilt.
There's a lot of guilt that I failed myself. I failed the pregnancy. I failed the family. I failed everything.
Absolutely.
I think it's because of lack of knowledge. And at that time, because we also hold back when we're trying to understand what is happening.
I think societally there's also a big, often people would be like, why? I find that it happens a lot where things that happen in the baby are quickly linked to the mum. And yes, there's medical evidence for a lot of things, but even when there isn't medical evidence, sometimes we don't know why prematurity happens.
Yes.
But people are so quick to be like, did you eat a mango? Did you go and exercise? Do you know what I mean? People will find a reason why the prematurity happened to you.
Yeah.
And what we're not aware of is, as much as we're like, why did this happen? That mother's mourning. She's mourning all the ideas she had for this perfectly turned, big, bouncy, chubby baby.
With my doctor, my gynae's Dr. Kamez, we had this water birth planned in place. And we had it, and I said it, and I said it to her. As I enter the hospital on that day, we need to have a professional photographer capturing the moment. And I had booked a maternity photo shoot. But I think my daughter was like, no, this one is, now she's too much.
No, it's too much for me. I don't want that stuff.
And at that time, it's my first pregnancy. My tummy was not even showing. It only started to pop a little bit in November. And that's when some people who noticed, or there's something in the oven there, And before they know it, this person is a mom. How?
Yeah.
How are you a mom when we just didn't see anything?
Yeah.
Wow. And how long did the boy stay in the NICU?
3 months. So almost to the day. So they came home, they didn't come home
at the same time.
Exactly the same time, and I'm so grateful for that in retrospect because I
it
don't know,
prepared you for the next
you
one.
Kind of prep for one, okay. They also came home in a routine, which was very nice.
Yes, I love that because that, I think it puts a lot of families at ease.
Absolutely.
Because we didn't know how the nurses do it there, and towards discharge, they sit you down. This is what we do every 3 hourly. This is what we do, and just to prep you.
Yes. Wow. So the first one came home probably around mid to end of May, which would have been about 2.5 months. And the last one came home 2 days before my original due date. He came home at 38 weeks, basically. Yeah, so yeah, and it was quite an experience, but we're so grateful, you know. And today they are 9.5 and healthy and boisterous and funny and creative, but just the best.
And they're keeping everybody on their toes
Absolutely.
in the house.
Absolutely on their toes. You have no idea.
So in your house, you must be having a very busy morning when you prepare lunch
Oh,
boxes,
yeah.
when you prepare cereals, and then the other one doesn't want to wake up. Like, Mommy, please,
Yes,
5 minutes.
Yes,
Mommy, please.
Yes. This bed is so cozy, I'll say. It's just like, no.
It's time.
Yeah.
9.5.
Yeah.
And you're excited for the double digits.
We'll see. For now, it's looking okay.
For now.
We'll see. Yeah, we'll see.
My daughter has been raving about her turning 10 years. Mommy, I'm turning 10 years this year. I'm like, yo.
Are you ready?
I'm not sure if I'm ready.
Yeah.
I'm not sure. Already you've seen there's some evidence that you're wondering if is mommy going to cope here?